Imagine your brain as a bustling city. Information flows like traffic, constantly moving through a network of roads and highways. These roads and highways are your blood vessels, supplying vital oxygen and nutrients to every corner of your brain. But what happens when there's a sudden traffic jam? This, my friends, is a stroke. A stroke occurs when a blood vessel in the brain either becomes blocked or bursts. Without a steady supply of oxygen and nutrients, brain cells begin to die. Strokes are often called brain attacks. Like heart attacks, they can strike suddenly and without warning. The effects can be devastating, robbing individuals of their ability to move, speak, or even think clearly. Stroke is the second leading cause of death worldwide and a major cause of long-term disability. By understanding the signs, symptoms, and risk factors, we can arm ourselves with the knowledge to act fast. Early recognition and treatment are crucial for improving outcomes and reducing the long-term impact of stroke. In the fight against stroke, knowledge is power. The sooner we recognize the warning signs and seek medical attention, the better the chances of limiting damage and improving outcomes. One of the most common symptoms of stroke is sudden weakness or numbness in the face, arm, or leg. This weakness is often one-sided, affecting only one side of the body. Imagine trying to lift both arms, but one feels heavy and unresponsive. Another red flag is difficulty speaking or understanding speech. Words may sound jumbled, or you may struggle to find the right words to express yourself. If you or someone you know experiences this, don't dismiss it. Time is of the essence. To help people remember the key signs of stroke, medical professionals often use the acronym FAST. F is for face drooping. Ask the person to smile. Does one side of their face droop or appear uneven? A is for arm weakness. Ask the person to raise both arms. Does one arm drift downward or feel difficult to lift? S is for speech difficulties. Ask the person to repeat a simple sentence. Is their speech slurred or difficult to understand? T is for time to call 911. If you observe any of these signs, even if they are fleeting, call emergency services immediately. Early intervention is vital for minimizing brain damage and maximizing recovery. Beyond FAST, other subtle signs. These can include sudden confusion, trouble walking, loss of balance, or a severe headache with no known cause. Also, sudden vision problems such as blurred vision, double vision, or loss of vision in one or both eyes. Any sudden onset of neurological symptoms warrants immediate medical attention. When it comes to stroke, it's always better to err on the side of caution. Unraveling the root causes. What leads to stroke? Strokes are usually the result of a combination of factors, some within our control and others beyond it. One of the most common culprits is atherosclerosis, a condition in which fatty deposits, called plaque, build up on the inner walls of our arteries. This buildup can significantly reduce blood flow, making it harder for the brain to receive the oxygen it needs to function properly. Think of it like cholesterol-laden gunk accumulating inside those pipes, slowly narrowing the passageway. Lifestyle choices. Navigating the path to stroke risk. While some risk factors for stroke are beyond our control, many are directly influenced by the choices we make every day. Our lifestyle plays a pivotal role in determining our overall health and well-being, including our risk of stroke. A diet high in saturated and trans fats, cholesterol, and sodium can contribute to atherosclerosis. Physical inactivity is another major contributor to stroke risk. Exercise helps lower blood pressure, improve cholesterol levels, and maintain a healthy weight. Smoking is another dangerous habit that significantly increases stroke risk. Quitting smoking is one of the most impactful things you can do to protect your brain health. Beyond control, unmodifiable risk factors. While lifestyle choices play a significant role in stroke risk, some factors are beyond our control. One of the most significant unmodifiable risk factors is age. As we age, our blood vessels naturally become less elastic and more prone to damage. Genetics also plays a role in stroke risk. If you have a family history of stroke, you may be at increased risk. Certain medical conditions such as high blood pressure, diabetes, and atrial fibrillation can also increase stroke risk. Managing these conditions effectively through medication and lifestyle modifications is crucial for minimizing stroke risk. Unmasking the culprit ischemic stroke. The most common type, accounting for about 80% of all strokes, is called ischemic stroke. In an ischemic stroke, a blood clot blocks an artery supplying blood to a part of the brain. This blockage starves brain cells of oxygen and nutrients, causing them to die rapidly. These blood clots, often formed by a buildup of plaque in the arteries, can break loose and travel through the bloodstream. When they reach a blood vessel too narrow to pass through, they get stuck, creating a blockage that disrupts blood flow to the brain. When walls crumble, hemorrhagic stroke. While ischemic strokes involve a blockage in blood flow, hemorrhagic strokes are characterized by a rupture in a blood vessel in the brain. When a blood vessel in the brain ruptures, it causes bleeding in the surrounding brain tissue, disrupting normal brain function. This rupture can occur due to high blood pressure, aneurysms, and arteriovenous malformations. Hemorrhagic strokes are less common than ischemic strokes, but often more severe. The bleeding in the brain can cause a rapid increase in pressure within the skull, compressing brain tissue and potentially leading to life-threatening complications. A transient glitch understanding transient ischemic attacks, or TIAs. Sometimes stroke symptoms can be fleeting, lasting only a few minutes and then disappearing completely. These mini-strokes, known as transient ischemic attacks, are serious warning signs. TIAs occur when a blood clot temporarily blocks an artery, causing stroke-like symptoms that resolve when the clot dissolves on its own. While TIAs don't typically cause permanent brain damage, they are strong indicators of an increased risk of having a major stroke in the future. Think of them as temporary power outages in the brain. Location, location, location. How stroke affects the brain. The brain is divided into different regions, each responsible for specific functions. A stroke's impact depends largely on the location of the brain injury. For example, a stroke affecting the left side of the brain might lead to difficulties with speaking and understanding language. A stroke affecting the right side of the brain might cause problems with coordination and balance. Understanding the relationship between stroke location and its effects is crucial for tailoring treatment and rehabilitation strategies. Shielding your brain. Strategies for stroke prevention. Effective stroke prevention involves a multi-pronged approach, addressing various risk factors simultaneously. One of the most crucial steps is managing existing medical conditions. High blood pressure is a major risk factor for stroke. Working with your doctor to control your blood pressure through medication and lifestyle changes is paramount. Diabetes also significantly increases stroke risk. Managing diabetes through medication, regular blood sugar monitoring, and healthy lifestyle choices is essential for reducing stroke risk. Remember, our brains are precious, and taking proactive steps to safeguard them is an investment in our future well-being. The power plate. Fueling your body for brain health. Just as low-quality fuel can clog an engine, an unhealthy diet can contribute to stroke risk. A heart-healthy diet, rich in fruits, vegetables, whole grains and lean protein, is also a brain-healthy diet. These foods provide essential nutrients, antioxidants and fiber that support blood vessel health. Limiting saturated and trans fats is crucial. Opt for healthy fats found in avocados, nuts, seeds and olive oil, which can benefit heart and brain health. Mind your body lifestyle modifications for a stroke-free life. Regular physical activity improves blood flow and strengthens blood vessel walls. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Smoking is one of the most damaging habits for both heart and brain health. Quitting smoking is one of the most significant gifts you can give yourself and your brain. Managing stress is another crucial aspect of stroke prevention. Chronic stress can lead to elevated blood pressure and inflammation. Find healthy ways to manage stress, such as exercise, meditation, or pursuing hobbies you enjoy. Navigating the aftermath of stroke, management and recovery. A stroke, like a sudden storm, can leave a path of destruction, impacting individuals and their loved ones. But even in the aftermath, there is hope for rebuilding and renewal. Stroke management and recovery require patience, perseverance, and compassion. Immediate focus is on stabilizing the individual and minimizing brain damage. This involves medications to dissolve clots and control blood pressure. Prompt treatment improves outcomes and reduces long-term disabilities. Recovery is a highly individualized process. The brain can adapt and rewire, leading to significant improvements. Recovery varies based on stroke severity, location, and individual health. Rehabilitation helps regain skills and adapt to new ways of living. Therapists provide support, encouragement, and strategies to overcome challenges. Rebuilding lives, rehabilitation and therapy. Rehabilitation after a stroke is not merely about restoring physical function, it's about rebuilding lives piece by piece. It's a multifaceted approach that addresses the physical, cognitive, emotional and social aspects of recovery, empowering individuals to regain independence and live life to the fullest. Physical therapy focuses on improving mobility, strength, coordination and balance. Imagine relearning to walk, dress or eat. Tasks we often take for granted until they become challenging. Physical therapists work patiently with individuals, using a variety of techniques and exercises to help them regain these essential skills. Speech therapy addresses difficulties with communication and swallowing, common after a stroke. Imagine struggling to find the right words or having trouble articulating your thoughts. Speech therapists help individuals regain language skills, improve speech clarity, and develop strategies to overcome communication barriers. Occupational therapy focuses on regaining independence in daily activities such as bathing, dressing, cooking, and managing finances. Imagine the frustration of not being able to perform these everyday tasks that once seemed effortless. Occupational therapists help individuals adapt to their new realities, finding ways to modify their environments and develop new skills to navigate daily life. Finding strength in unity, support for stroke survivors and caregivers. Stroke recovery is an ongoing process that requires support for both survivors and caregivers. Support groups offer a safe space to connect, share experiences, and find encouragement. Counseling helps cope with the emotional impact of stroke. Caregiver support is essential to prevent burnout and stress. Remember, no one has to face stroke recovery alone. Reaching out for support can make all the difference. Stroke, a race against time. We've journeyed together through the intricate world of stroke, exploring its causes, symptoms, types, prevention strategies, and the long road to recovery. Just as a skilled conductor guides an orchestra through a complex symphony, we've navigated this intricate medical landscape, seeking harmony between knowledge and action. Remember the bustling city analogy we began with? A stroke, like a sudden traffic jam, can disrupt the flow of life, leaving lasting consequences. But unlike a traffic jam, where time might be an inconvenience, in a stroke, time is brain. Every minute counts. The faster we recognize the warning signs, the drooping face, the weakened arm, the slurred speech, and seek immediate medical attention, the better the chances of minimizing brain damage and maximizing recovery. Think of it as a race against time, where early intervention is our greatest weapon. Knowledge is power. Empowering ourselves and our loved ones. Knowledge, they say, is power. And in the realm of stroke, this adage couldn't be truer. By understanding the risk factors, embracing a healthy lifestyle, and being aware of the warning signs, we empower ourselves to take charge of our brain health and protect those we love. Imagine a world where everyone is equipped with the knowledge to recognize a stroke, a world where fear is replaced by action, and where timely intervention becomes the norm. This is the world we can strive to create, a world where stroke no longer casts such a long shadow. Remember, stroke is not a death sentence. With timely treatment, rehabilitation, and unwavering support, Individuals can make remarkable recoveries and live fulfilling lives. Let us continue to learn, to share our knowledge, and to advocate for better stroke prevention, treatment, and care. Together we can make a difference, one brain, one life at a time.